I'm Dr. Colleen Cotton. I'm an associate professor of dermatology and pediatrics at the George Washington University School of Medicine and Health Sciences, and I'm an attending physician and director of our multidisciplinary pediatric HS clinic at the Children's National Hospital in Washington, D.C. So, to start, while overall across all the ages that we consider to be pediatrics, HS is pretty rare. When you actually look at the epidemiology of the disease in adolescents, particularly adolescents with skin of color or of lower socioeconomic backgrounds, that incidence is somewhere between half to 1%, which is on par with the amount and frequency of the disease that we see in adults. So, really, when we're thinking about adolescents, there's one study that looked and said about half of patients, adult patients with HS, first had their symptoms when they were under the age of 20 and started in adolescence. And so it's really the time that this starts for a good chunk of people who end up continuing on with this disease into adulthood. Now, it may not be as obvious initially that this is what people are dealing with. There is, on average, about a 2-year delay between the onset of symptoms and when people receive a diagnosis in pediatrics. But there are likely others that have an even longer delay. So in adults, that delay is estimated at 7 to 10 years. You can imagine if you started having symptoms in adolescence, 7 to 10 years go by, you're now an adult. So when it's recognized in adolescence, that gap is shorter, but there are likely patients who are not being recognized at all until they're adults. Part of that can be because initially, when starting out, we think about recurrence as one of the hallmarks of this condition. But in children, that recurrence may not happen as frequently as early on as it does in adults or when the disease is more established. So in adults, we think about having had at least two or more flares within a 6-month period. That doesn't always apply to kids. But if you expand that definition to about a year, you'll catch about 80 to 90% of patients who have HS, even if they're not having flares as frequently. And it is very important to recognize these kids as soon as possible because we know there is this window of opportunity for us to intervene. The more scarring and the more tunneling happens in this disease, which happens with repeated recurrences and more severe inflammation from flares, the harder it is to get that disease under control. We know that our medications don't work as well in people who have had disease for longer or who have more of a scarring or tunneling burden. There was a retrospective study several years ago that looked at patients with HS who presented to pediatric dermatology. About half of those patients already had scarring or at least one tunnel at the time that they presented for evaluation. So we know that this is happening early, this is happening rapidly, and the sooner we can get these kids recognized and referred for appropriate treatment, we know that the better they're going to do and the better our treatments are going to do.